In our rounds discussion this week, we talked about chronic subdural hematoma. So I just want to talk through some things that you should know about the nature and what is a chronic subdural hematoma. First of all, hematoma just means blood, a blood clot or a collection of blood. And chronic means old. In the case of a chronic subdural hematoma, it's sort of this general category of fluid collections and blood clots on the surface of the brain that are old, or they've been there for a little while, and they're a different pathology than acute subdural hematoma, which would be that blood that just started bleeding recently, like within the last day or 2 or 3 days or something like that. So what are the symptoms of a chronic subdural hematoma? Well, the fluid collection is putting pressure on the brain, so patients can have headaches, they can have decreased strength on one side of the body, they can have even stroke-like symptoms. So if you or a loved one are having these symptoms, then it would be good to get a CT scan to look for, among other things, a chronic subdural hematoma. When bleeding occurs anywhere in the body, it elicits an inflammatory reaction, and that's just a fancy term for it causes some swelling. The body sends blood cells and other factors to the area, and it starts to wall the blood clot off and break it down. We know this when we get a bruise on the skin. In the case of a chronic subdural hematoma, the body reacts to the blood that occurs, and the reaction causes a capsule to form around the hematoma. That capsule can then recruit blood vessels to it and be the source of ongoing fluid collection within the subdural space. So a patient may have a chronic subdural hematoma that's growing, but not actually bleeding more. It's just getting bigger. When we do surgery for a chronic subdural hematoma, we have to decide, can we drain the fluid through a burr hole, which is just a small hole in the skull, and we drain the fluid through the hole, or do we need to do a craniotomy, which is to open up the skull and remove not only the fluid, but the capsule or the membrane around the fluid, which is the source or potential source of that ongoing fluid collection. So that's one of the decisions that we have to make as surgeons. And a lot of times we can get away with a smaller surgery, and then sometimes we need to do the bigger surgery. Other things to think about. Patients with chronic subdural hematomas are at risk of seizure. So we usually will give patients some seizure medication to prevent seizures, because that can be a really bad problem for patients. We also like to give IV fluids to make sure that they're well hydrated. The brain gets pushed over by the subdural hematoma, and we want the brain to be full and re-expand to fill the space. Another thing that we'll do, and there's evidence in recent literature for this, is give 2 medications to prevent that inflammatory reaction that causes the subdural hematoma to either persist or happen in the first place. And we use a medication called atorvastatin, which is used to treat high cholesterol. Now, cholesterol can build plaques in the arteries, and it's this inflammatory process that creates the plaques. And it's thought that the atorvastatin blocks the formation of the plaque in the arteries, but it can also block the formation or recurrence of a chronic subdural hematoma. So we like to give that medication for about 5 weeks. And then the other thing that we do is give a small dose of steroid during that same period of time, again, to block that inflammatory reaction and prevent a subdural hematoma from coming back or from requiring surgery because it didn't get better on its own. Finally, One of the best things we can do for management of chronic subdural hematomas is prevent them in the first place. Many of them are in older patients due to falls, and we want to do everything we can to prevent falls in our older patient population. So in conclusion, if you or a loved one are having signs or symptoms of a chronic subdural hematoma, which would include headaches, decreased strength on one side of the body, or any kind of drowsiness or sleepiness, consider getting checked out and getting a head CT to evaluate for, among other things, a chronic subdural hematoma.